I enter the patient's room, I am going to check the patient's chart for any new or existing orders. I'm going to check if any labs need to be ran or have been run. I'm going to check outside the door for any flags, and I'm going to don any PPE if needed before I enter the room. And after that, I'm going to go ahead and enter. Hi, my name is Camryn. I'm going to be your nurse today.
Hi.
Hand sanitizer for my hand hygiene. Could you verify your name and date of birth?
Megan Enter, June 25th, 2004.
Alright, I'm just gonna check that wristband to make sure it matches. What brings you in today?
I twisted my ankle and it hurts.
Sorry about that. I'm gonna lift up this blanket so I can take a look, okay? Which ankle is it?
This one. It's like in this area.
Alrighty. And when did this happen?
2 days ago.
2 days ago? Do you know what you were doing when it happened?
I was bowling.
You were bowling. How would you describe the pain?
It's kind of like a throbbing pain.
A throbbing pain? Does it radiate anywhere?
No, it kind of stays in the area.
Okay. Does anything make it feel better or worse?
Yeah, so it feels better when I kind of just like rest it, put it up and ice it. And it feels worse when I kind of like put pressure on it when walking.
Okay. Have you tried wrapping it up at all?
No.
No. Alrighty. And how would you rate the pain on a scale of 1 to 10?
I'd rate it like a 3 right now.
A 3? Alrighty. Go ahead. Drop this down. We'll start with your vitals, okay? Alrighty. Let's start with your blood pressure. Alright. So I'm just going to start by finding your brachioradial pulse. Alright, now I'm going to estimate your systolic. Alright, I stopped feeling it at around 110. So I'm going to pump it up 30 past that. And I'm going to find your blood pressure using my stethoscope, okay?
Okay.
Alright, I actually got you at 112/82. Okay. We'll go ahead and take this time. Alright, I'm going to put this oscillometer on your pointer finger. You can go ahead and relax. Right, so your oxygen rate is at 99 and your heart rate is at 98. I'm just going to double check that with using your apical pulse. It's going to be on your chest. I'm just going to listen for it for a full minute, okay?
Okay.
Alright, you can just stay right there. Alrighty. So I got 96 for that, and I was also checking your respiratory rate while I was doing that, and I got 16. So that was perfect. Now I'm going to go ahead and get your temperature. And also, your your breathing was not labored at all, so no issues there. All right, 98.4. Now I'm going to check the size of your pupils, okay? If you don't mind just looking straight at me. Alrighty, you are at a 6 for both. Now I'm just going to check your pupil reflex with light. Alright, so it is direct and consensual, equal on both sides, reactive, so that's all good news. And now I'm just going to move on to the general and neuro. So you look alert, you are relaxed, your hands are just in your lap, your face is relaxed as well, no drooping to one side or anything. You don't have any speech problems, no slurring. You can hear me well. You don't have to read my lips, and I don't have to raise my voice for you to hear me. And I'm just going to go ahead and feel your arms for temperature. Alright, bilaterally warm and equal. And check your legs. Same thing, bilaterally warm and equal. And while I'm down here, I'm going to go ahead and check for edema as well. No edema. I'm going to check your capillary refills. Awesome, less than 3. And then I'm just going to go ahead and check your pulses as well while I'm down here. Alright, 2+ for the dorsal pedis. 2+ for the posterior tibial. Let me check your radialis. 2+ for the radial pulse. So that's all normal right there. I'm going to have you push down on my hands. Perfect. Push up. Awesome. And then before I go any further, I just want to make sure that you are oriented to person, time, place. Do you remember who I am?
Camryn.
Alright. And you know where you're at?
I met you, Mary.
And you know what date it is?
It's Friday, July 12th.
Perfect. And if she was in a coma, I would go ahead and use the Glasgow Coma Scale to scale how alert she is. But she is alert and oriented, so no issues there. I'm going to go ahead and test strength on your upper extremities. Could you squeeze my hand for me? Awesome. Could you do this? I'm going to have you push against me. Pull. Awesome. And then I'm going to check your capillary refills on your fingers. Great. Less than 3 seconds. And so now I'm going to go ahead and move on to your cardiac system. So I'm just going to listen to your heart with both the diaphragm and the valve. I'm going to listen to the aortic valve, the pulmonic valve, the Erb's point, the tricuspid valve, and the mitral valve. Okay? And I would also go ahead and check for any equipment for DVT, TED hose, make sure that all that equipment was working properly and turned on. But since she doesn't have that equipment, I will not be doing that today. So I'm going to go ahead and listen. Okay. I'm going to start at the aortic valve, second intercostal on the right side. Then I'm going to listen to the pulmonic valve, which is on the left side, second intercostal space. And then I'm going to listen to Erb's point, which is going to be third intercostal space on the left of the sternum. Awesome. I'm going to listen to the tricuspid valve, fourth intercostal space left of the sternum. And the mitral valve, which is going to be the fifth intercostal space, mid-clavicular line. And I would do this under her clothes normally, but for privacy and consent, I am doing it over the clothes for the video. Same with the apical pulse. I would have normally done that under the clothes, but for privacy reasons, did them over. All right, so I didn't hear any murmurs, no extra heart sounds. Everything seemed great. You're pumping steady, and so no issues there at all. I already did your capillary refill to make sure. Your S1 sounds were heard best at the base of the heart, or at the apex of the heart, which is the bottom of the heart. Your S2 sounds were heard best at the top of the heart, which is the base. I did your capillary refill, so that was all good. And everything looks good there. I'm gonna go ahead and listen to your lungs as well while we're on this, okay? Alright. And actually, before I move on to the lungs, I'm gonna listen to the same spots with the bell, okay? So, aortic valve, pulmonic valve, Erb's point, tricuspid, and the mitral. Awesome. Okay. Yeah. Everything sounds good. So now I'm going to go ahead and listen to your respiratory system, okay? So while you're doing this, first off, I'm going to check to make sure that she doesn't have an oxygen mask. If she did, I would check that, make sure that the mask was fitted snugly. I would check the flow rate as well, just to make sure that all of that goes well. So now I'm going to go ahead and just take a listen, okay? You're going to inhale through your mouth, deep inhale. Ready? I'm going to listen to 6 points on the front. And I'm going to listen to your sides. Okay, so I'm going to have you turn it. If you don't mind facing me this way, actually. Okay. Thank you. And listen to your back. Alright, deep inhales through the mouth. Okay, I didn't hear any cracks or stings, so that's good. Again, it was on labor, so no issues with that. And so, if you did have issues breathing, I would educate you on a spirometer and how to breathe and help you breathing with that. But she does not have to use that today. And so now I am going to go ahead and just ask you if you have a cough.
I don't.
No cough.
No.
If she did have a cough, I would check for ask if she had any mucus, and then I would ask about color, amount, and consistency of that. I'm gonna go ahead and check your pulses. Actually, I think I already did that right there. Yeah, 2 placebo. You're fine with your pulses. So I'm gonna have you go ahead and lay down. I'm gonna check your.
Okay.
Ready. Do you mind if I lift up your shirt, or would you like it down?
Oh, no, you're good.
All right. So I'm just gonna take a look and make sure that there's no incisions, no ostomy. And then after I do that, I'm gonna go ahead and ask you if you've been nauseous recently. Any changes to your diet?
No.
All is well. All right. Now I'm gonna go ahead and auscultate, starting with the right lower quadrant and going counterclockwise or clockwise. All right. Vowel sounds are present in all 4 quadrants, and I'm gonna go ahead and do a light palpation on this. Okay. All right, perfect. No tenderness, no pain or anything. All right. Her abdomen is flat, contour of it. No masses, no hard masses felt during palpation. No tenderness. So everything looks good there. I'm gonna go ahead and have you sit back up for me. Okay. All right. And so now I am. You said that you're not nauseous. I'm gonna ask you about your stool. So, when's the last time that you had bowel movement?
Yesterday.
Yesterday? How often do you usually have bowel movements?
Like once every other day.
Once every other day? Sounds good. For the Bristol stool scale, how would you rate it?
Like a 3.
A 3?
Mm-hmm.
Alright, so sausage, but with cracks on its surface. And you don't have any like constipation or pain?
No.
No. Awesome. What color is it usually?
Brown.
Brown.
Mm-hmm.
Okay. And also along the lines, urine. How often are you going to the bathroom to pee every day?
Like 4 times a day.
4 times a day? Alright, that's pretty normal.
Mm-hmm.
What color and is it cloudy and
No, it's yellow. It's not really cloudy, no.
it's kind of clear?
Mm-hmm.
Awesome. And if you had any urinary retention, then I would use a urine scanner on your bladder just to check for that. But that looks like everything is well. I've been assessing your skin this entire time. I don't notice any lesions. Do you have anything under your clothes?
No.
No? Alright. Then, that as well, you're, like a pink tan, so I don't see anything abnormal with your genetic background. And, uh, so that all looks well, but if she was at high risk, I would use the Braden scale to assess for any lesions. And I would definitely check like the back of her head, and all of those bony points during that assessment if you were in bed rest. All right. So I think that is going to conclude our examination. Do you have any questions for me or concerns?
No.
All right. I'm just going to make sure that your bed is at the lowest position. Your bed rails are up. You want the bed rails up?
Yeah.
All right. I'm going to put your brakes on your bed. I'm going to put your call light right next to your pillow.
Okay.
Make sure you have a blanket and pillow. And then I am going to do some hand hygiene before I leave the room. And it was nice meeting you, Megan.
Yes, thank you.
Thank you.